What tests confirm active TB versus latent TB status? Imagine trying to tell if someone is sick right now or just carrying a dormant infection. That's exactly what doctors do when they test for tuberculosis. No single test can definitively tell if TB is active or just latent on its own. Instead, they use a combination of tests and clinical clues to make a clear diagnosis. First, there are tests that show if someone has ever been infected with TB, whether active or latent. The tuberculin skin test involves injecting a small amount of purified protein derivative under the skin. After 2 to 5 days, the healthcare provider measures the swelling or induration. A positive result means the person has been infected with TB bacteria at some point, but it doesn't tell if the disease is active or just latent. Similarly, blood tests called interferon-gamma releases assays measure how the immune system responds to TB-specific antigens. These tests also indicate infection but cannot distinguish active disease from latent infection. To confirm if TB is active, microbiological tests are essential. The most reliable method is to detect the bacteria directly from clinical samples, usually sputum. Sputum smear microscopy looks for acid-fast bacilli under a microscope, but it's less sensitive. The most sensitive test is mycobacterial culture, which grows the bacteria from the sample and confirms active infection. It also allows doctors to test which drugs can effectively treat the bacteria. Rapid molecular tests called nucleic acid amplification tests, or PCR, detect TB DNA quickly and with high accuracy, providing strong evidence of active disease. Alongside these tests, doctors evaluate symptoms like a persistent cough, weight loss, night sweats, and look at chest X-rays for lung abnormalities. These clinical signs support the microbiological findings. Distinguishing latent TB from active TB relies heavily on these results. If someone has a positive immune test but no symptoms, normal chest X-ray, and negative sputum tests, they likely have latent TB. In contrast, active TB usually presents with symptoms, abnormal imaging, and positive microbiological evidence. Researchers are exploring new biomarkers like IL-15 and MCP1 levels that might help differentiate active from latent TB in the future, but these are not yet part of routine testing. In summary, immune-based tests like the tuberculin skin test and interferon-gamma releases assays show if someone has been infected with TB but don't tell if the disease is active. Confirming active TB requires detecting the bacteria directly through sputum tests, cultures, or molecular diagnostics, combined with clinical signs. If no bacteria are found and there are no symptoms, the person probably has latent TB. Always remember, diagnosis is complex and individual, so consulting healthcare professionals is essential for accurate assessment and treatment.